Chapter 14, Promoting Health. So just a disclaimer, I don't own this material. Under fair use, I'm providing the lecture content for my nursing students using this material. All content within is for educational purposes for nursing students and does not provide medical advice. So, what is health? According to the World Health Organization, who now have a new name, it's a state of being completely physically, mentally, and socially well, not just the absence of disease. So, health promotion, when we talk about health promotion, more of our care needs to be in health promotion and maintenance than illness care. So, our goal is to keep people healthy instead of treating them when they're sick. Does that line up to the current level of healthcare that is provided? Okay. So, health promotion helps individuals develop a state of physical, spiritual, and mental health well-being. Activities are useful to all individuals because they encourage optimal functioning. So, again, I've said it about 1,000,000 times in this module that it's physical, spiritual, and mental well-being. So you have those three realms together, which makes up holistic care. So people must be motivated by the desire to increase well-being. We need to get people to think more well-being than sickness, right? It's related to individual lifestyle choices, and Healthy People 2030 are the new national initiatives for right now. There's been Healthy People 2000, 210, 220, 230, so they put them out every 10 years. So the Healthy People 2030 initiatives are addressing the effect of lifestyle on health, creating health improvement goals, and eliminating health disparities. Gene Watson was a big theoretical mindset. Gene Watson says that health is the high overall functioning or a state of mind. Betty Newman says that it's a continuum of energy. And Myers, Sweeney, and Whitmer came up with the integration of mind, body, spirit. Those with disease can be healthy. So you can be healthy and still have a disease process. Health protection is motivated by the desire to avoid illnesses. Health prevention is a different level of activities. So you need to know this slide, okay? This is one of the biggest questions on NCLEX and on test questions. There are 3 levels of activities. If you think about it, primary activities are made to prevent or slow the onset of the disease. Secondary are going to detect and treat illnesses in earlier stages. And tertiary is to stop the disease progression. So you already have the disease, but we're trying to make it the best quality of life in that disease process and return to pre-illness state. So whenever you think about different health prevention activities, okay, that's what we think about. So an example of a secondary health prevention activity. Health prevention, let's go back. Secondary is used to detect and treat illnesses in early stages. So if you think about colon cancer, prevention, treatment, detection, right? So the American Cancer Society recommends that beginning at age 45, both men and women at average risk of developing colorectal cancer use one of the several screening exams. Colon cancer, you have different levels of screening exams, right? So the first level is an occult blood stool. So they take, basically, they take a tongue blade, take a part of the stool, smear it on a card, turn it over, and do the drops of developer that sees if there are hidden blood, occult, hidden blood in the stool. And that's one level. Then if that comes back positive, you go for a colonoscopy. Okay? So health screening activities are included in the definition of secondary health prevention. You've got to know those. That's going to come back to haunt you forever. So health behaviors. What kind of health behaviors do we target? One of the big things is teen pregnancy, abuse of alcohol and illicit drugs, cigarette and e-cigarette use, vaping, and the whole deal, obesity, and sedentary lifestyle. So getting people to get up and get off the couch for at least 30 minutes a day, 3 times a week. Okay, so this is Pendler's health promotion model, and that's a wheel of wellness. So the wheel of wellness is a trans-theoretical model of change, and it's in 6 stages. So again, when I talked about change not being linear, right? So change is never linear. Whenever somebody says they want to change something, whether that's I want to stop drinking, I want to stop smoking, whatever, these are the 6 stages that someone goes through. Again, something you need to know. Pre-contemplation is before I even contemplate. Okay? Then they get into contemplation, where they start thinking, I really should do something about this. But what should I do about it? Right? Preparation is when they actually make preparation for the change. So cleaning out the dirty food in your house, cleaning out the chips, cleaning out the bad foods, right? Preparation is getting ready to. Action is when you actually start it. The maintenance is during the process when your mindset changes from I'm going to lose weight to maintaining this weight or maintaining this change. And then termination is when you no longer need to think about not doing that because it's become a way of life. So the Wheel of Wellness has six how do you say? Parts of the wheel. So you think of the mental, the emotional, the social family, the physical, the spiritual, and the occupational parts of your life. And you basically, there's usually a 0 to 10 out from the middle of the wheel. And you draw a circle around because that's going to show you where your flat tire is. When you have a flat tire, that's the one you should work on first. So you're bringing out your numbers from 0 to 10. So it shows you where you need to make some changes. The patient newly diagnosed with type 2 diabetes needs to make lifestyle changes. In relationship to the trans-theoretical model of change, which nursing action would best support the patient during the contemplation stage? Contemplation. Thinking about it. Okay. Showing the patient how to use the fingerstick blood glucose monitor, providing information about various types of exercise to facilitate weight loss, teaching the patient about the purpose of having their hemoglobin A1C tested monthly, or telling the patient if they don't change their lifestyle, they will die. So in these kind of questions, if you think therapeutic communication, it will probably get you a lot farther than you think, right? So contemplation, they're thinking about it, but they're not sure what they should do. So we usually provide information in that point. So what information would help them the most? The blood sugar, they should be able to do by now because they're trying to make a lifestyle change. This question is less about the type 2 diabetes and more about the lifestyle change. So that's how they're trying to trick you with this question. Teaching the patient about the purpose of having their, no. A and C is out, D is out. The only one that makes sense for lifestyle change is different types of exercise they might consider. Contemplation, consideration. You're providing them some information. They can say yes or no, but they're trying to get a plan ready to start preparing for the change. So this is before preparation. Preparation would be joining a gym, right? He's just thinking what activities he can do. Okay? So that's how you answer those kind of questions. The contemplation stage involves decision making. So the biggest thing that you do during that period is provide information about exercises so that he can decide which one he would like to do, which one fits their personal and professional and lifestyle. Okay. Health promotion programs disseminate information on either an individual or group level. They love these questions on the NCLEX. And it's about changing lifestyle and behavior, environmental control, or wellness assessment and risk appraisal. So health promotion programs, okay, changing lifestyle and behavior, emotional control. So health promotion program settings are health facilities, work sites, schools, physician offices, health clinics, hospitals, and community settings. It's kind of like a wellness clinic. You come in and they do your blood pressure, your weight, your blood glucose, right? Health promotion, keeping you well. So the nursing assessment in that is usually like a health history, a physical exam, looking at physical fitness, how physically fit are they? So testing muscle strength, flexibility, and cardiorespiratory fitness. So making them, so a good example of this is before you have bariatric surgery, they do a physical assessment on you and they send you to the cardiac rehab department in your area, and they make you walk 10 minutes around a track. And they're checking your cardiorespiratory fitness. So as you're walking, you have an O2 sat monitor on. They're also addressing your muscular fitness because if you can't walk for 10 minutes, that tells them how muscularly unfit you are. Okay. So they're doing a baseline assessment so that they can do a post-op assessment later and show the improvement from losing the weight. A lifestyle and risk appraisal, so a personal responsibility, so they're making you take personal responsibility for this. Physical activity, nutrition, interpersonal relations, spiritual growth, stress management, and health risk appraisal tools that might be used. So if you go in and they're doing like a colorectal screening, they'll tell you to go in the bathroom, take the little tongue blade, put 2 pieces in the on the back of the card. You come back out, they put the thing on, right? So that's a health risk appraisal tool. They could also hand you a survey that asks how many people in your family have had colorectal cancer. Has your mom, has your dad, has your mom and your dad on your mom's side, has your dad and mom on your brother's side, right? You know these. So health risk appraisal tool, think about that as well, like allergy. When you go to the allergy clinic, they ask you how many times a week you've been using your inhaler, how many times a week you've missed work because of your asthma, right? It's a health risk appraisal. The other one that they do is like sleep apnea. They ask you to do the stop bang score. The stop bang score tells them how bad your sleep apnea is, how many times a week you don't get enough rest, those kind of things. So they're quick questionnaires that kind of elicit information that tells you if there's a risk or not. As a nurse, you're going to teach a patient about strategies to prevent hypertension. In order to provide effective care, you know that the action that you should implement first is, okay, this kind of question is notorious for being ADPI. You know ADPI. Treat ADPI here, right? Assess, diagnose, intervene, plan, intervention, education, right? Okay, so right now, what would you think would be the first step of implementing? Okay, C, assess what they already know, right? They're going to lose interest if you tell them things they already know. So you need to assess for the gap in knowledge before you start teaching them. Okay? I can't tell you how many times we use ADPI in education. ADPI in nursing is the same ADPI in education. When you assess a gap, then you can fill it. If there's no gap, you don't need to do that, right? If their mom and their dad had hypertension and they took their blood pressures, why are you teaching them about taking their blood pressure? So, life stress review, that's based on the work of this person. It's stress-induced life-changing changes, daily stresses. It also measures your hardiness versus vulnerability. How much stress do you have in your life? Okay. And then health beliefs are about the cultural beliefs and personal experiences. So, do you think health is something given to you from God? Or do you think culturally that health comes from being a good person? That's going to change how we take care of that patient. So here we go. Your young adult patient asks you for help to quit smoking. Discuss at least two strategies you can suggest. Why might this patient be a good candidate for a support group? What objections might the patient have to participating in a support group? Okay, two strategies you can suggest. Locally in the community, where would you send them? So this is community resources, right? So like the American Lung Society might be a good website. Going to the provider to get a prescription for a smoking cessation aid, right? Sometimes there's a Florida state program that will actually give them those things at a reduced cost or free. This patient might be a good candidate for a support group, but it says young adult patient. So is that 18 or is that 23? I've got more questions to ask. But if it's an adolescent, they like to be with others, right? A support group might be a good reason, or they might object to it because they've got to work. They don't have time for group meetings. right? It depends on the interpretation of group meetings. According to Level and Clark's work, blood pressure screening is an example of what type of healthcare? Blood pressure screening is an example of primary prevention, secondary prevention, or tertiary prevention. This is exactly how they will be worded, similar with a story to it, but it's asking you that primary, secondary, or tertiary prevention. Remember these? So blood pressure screening, what do you think? Screening detection of illness in early stages tells you that it's a secondary because you're screening, they already have it. You want to catch it early. So it's not prevention, it's not primary, it's secondary. And then tertiary is reducing the signs and symptoms. Okay. So we do nutritional assessments all the time, right? How do you ask that? That's usually if anybody's ever gone to a weight loss clinic or any kind of, Jenny Craig, whoever's program, they're going to ask you for a 3-day recall. Okay. Typically 3 days you can do. Think about it. Write down everything you've eaten in the last 3 days. Depends how busy of a person you are, but 3 days is a little more realistic than a week. Some people can't remember what they ate for breakfast. But what we do is look at dietary patterns. Is this a high carb diet that they're eating? Is it a high fat diet that they're eating? A dietary recall is better when they know you're not watching. If they know you're watching, they're going to eat better, right? Think about it. The last time you went on a diet, as soon as you started tracking in the app on your phone, you started eating better. The nutritional assessment also tells us about body mass as well. So a health screening might be blood pressure screening, cancer screenings, laboratory tests. So sometimes people will have like a health fair and they'll have at their work or whatever, there's an employee health day where they come in and do all your lab tests for you just as a baseline wellness exam. So you can also usually walk into LabCorp and get these things done without a doctor's order because they're the health ones. They're not like diagnosing, but they're a health exam. So like cholesterol, right? So other health screening activities, cholesterol level, dental health, colon cancer, breast cancer, cervical cancer, testicular cancer, prostate cancer, and skin cancer. How many times a year do you see TGH or whoever out on the beach doing skin cancer checks, right? So you know these things, you may have seen them, heard them, and you're like, oh, that's really nice that they're doing that, right? You know going into healthcare that as a patient, you should be going and getting your pap smears done, those kind of things. Okay. Dental health, they do a lot with kids because of cavities, right? So I know in Montana there was a little bus that the hospital supported, and we would go to the Native American schools, and the parents would have to say yes or no, obviously, and they would come in and get a dental screening so that they knew if they were okay or needed some dental care. The biggest thing in the analysis part of this is knowing if they're ready for change. How do you motivate somebody? You can't motivate them, they have to be self motivated. So, usually, what we ask is, how motivated are you on a scale of 0 to 10 to change this? If they say zero, you hand them the brochure and you mark brochure given and move on. But eventually, giving them that brochure will start making wheels turn, especially if something lifestyle happens, family happens, right? A health crisis happens. Now they're going to take that a little more seriously and actually call that number. So you always think about readiness for change, okay? So program outcome will vary based on the focus area, but you're looking for outcomes. So if you're doing blood pressure checks, how many of those patients did you send to the hospital? How many of those patients went to the physician? What's your evaluation of those plans, of those programs that you're doing? It's going to definitely change. Think about that. Some are low level, some are high level. What you're doing in health promotion is trying to role model to them. You're counseling individually or through technology. So maybe the counseling comes 2 days later in their email box. Using technology is a good place now in this day and age. You can use emails to remind them about getting healthy. Health education, supporting lifestyle changes. So, thought process. While working in a physician's office, a 70-year-old woman is referred to you for counseling regarding health protection activities. She's hypertensive and obese. 70-year-old woman, health protection activities, hypertensive and obese. How does her age affect your assessment and your communication? What type of learning aids might be needed? What health screenings are appropriate for this client? Right off the top of your head, you should be saying ding, 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 osteoporosis. 70-year-old woman, health protection. What's going to happen with a 70-year-old? They're at high risk for osteoporosis. Postmenopausal, not having that estrogen anymore. Estrogen, bone health, right? Also the hypertensive, obese. Think about the weight on those bones. If she falls, hypertensive. If she goes hypotensive, she may fall. When she falls, she's going to break a hip. That's the thought process you're thinking about. Okay? What type of learning aids might be needed? Depends. If she has glasses, if she doesn't have glasses, can she read? She might be having cataract. She might be having macular degeneration. These are things we ask because you want to make sure that she has the right learning aids, right? Asking her to take her blood pressure every day might not be a learning need if she can't see the dial. Maybe having a digital one instead, right? What health screenings are appropriate for this client? Again, probably not a pap smear, right? A little late. Um, I would say hypertensive, obese, lipidemia, hyperlipidemia, maybe a PVD, PAD assessment. Does she have arterial sclerosis, right? Arteriosclerosis from that hypertensive, obese patient, fat clogging the arteries. Okay? That's kind of a thought process that you go through when you're thinking about what do I do, what do I not do for this patient. At 70 years old, an annual pap smear is probably not going to be appropriate. Maybe mammogram for sure, potentially, right? But eventually you get into the thought process of risk versus benefit ratio. Okay? She's 70, she's got quite a few years left. It's still appropriate to ask her about a mammogram. At 95, risk versus benefit ratio, You think she's going to choose to do chemo, radiation, all that for a breast cancer at 95 years old? Depends. You have to ask. There's a lot of questions that come up from this. Okay. Talk to you later.